Thank you all so much for coming. It's really great to welcome all of you here to the kickoff event for our Project 2Gen here at Cornell. My name is Rachel Donovan, and I'm a faculty member here and Senior Associate Dean in the College of Human Ecology. And before we get our program started, I just want to tell you a little bit about what we're doing here and frame up what we're about to be doing today. So Project 2Gen takes a two-generational approach to addressing the needs of vulnerable families. And what this means is that we support research and programs that think together about the needs of both parents and children, and also think about the context in which parents and children are living their lives, whether that's the workplace that parents are in, the children's educational context, the community in which they live. And so the 2Gen approach acknowledges that parents' well-being and children's well-being are intertwined, and that we really can't address one without the other. Project 2Gen is going to be a hub for innovative work that brings together research, practitioners, and policymakers developing and carrying out work in this area, testing new approaches, evaluating their effectiveness, and implementing them locally and throughout the state. And we also will be involving students in this work throughout, and we already have to a great extent. And so this is going to be a great way, this event is a really great way to get this work going and to hear from some of the leaders nationally about what's going on in this field. So 2Gen really reflects the mission of our College of Human Ecology, which is really both a land-grant institution as well as an Ivy League university. And so as such, we have a mission of not only producing the most rigorous research, but using it to make a difference of the lives of the people in New York State and beyond. So before we get started with this great event, I want to thank some people who really made this happen today. First and foremost is Carl Pillemer, who you'll be hearing from next. He's the director of the Bronfenbrenner Center for Translational Research, who's really supported and sponsored this, and without whose vision, this really wouldn't have happened today. So we're really grateful for Carl's support and the BCTR support. I also want to thank Elizabeth Day, our BCTR postdoc, who just started a couple of months ago and just hit the ground running and making this event happen and making it come to life. I want to thank our students, Frances Robinson and Sharon Glick, whose enthusiasm for this topic is infectious and it really inspires all of us. I want to thank Kim Kopko and Julia Chapman, who organized the parent education in-service that many of you attended that leads up to this event really nicely. And finally, I want to thank Carrie Chalmers and Patty Thayer, who did the communications and organization that obviously paid off really well, as you can see by this great event that we're having here. I also want to thank my partner in crime, Laura Tack, who you'll be hearing from in a little bit, whose intellectual vision is really what brought this forth. So I'm going to turn this over to Carl for a brief introduction, and then Laura will kick things off.
Thanks, and I will be really brief because I know everybody wants to go ahead with the program. First of all, it is thrilling to have like a standing room only capacity crowd here for this kickoff. It's really wonderful, and I think points to how important this topic is. I am incredibly grateful to Rachel and to Laura for coming up with this idea. And I'll say briefly, for those of you who don't know, the Bronfenbrenner Center was created out of the merger of two other centers about 5 years ago. And in brief, its major goal is to help people in the social and behavioral sciences craft a better marriage of science and service using the concept of translational research, which in its kind of briefest summary is taking the findings of top quality behavioral and social science research, like I'm sure that some of you do here, and moving it to more quickly, more efficiently, and systematically into real world settings. So we try to help people who want to take their concepts, methods, measures, and actually do research in community agency contexts or elsewhere. And we try to also gain the voice of community partners in understanding how we can align our research to needs of eventual stakeholders. And there's a whole range of programs, there are brochures out there, and if you just Google Bronfenbrenner Center, you'll find us. In terms of this particular initiative, one of the things that we've been trying to do in the Bronfenbrenner Center, a little bit at least, is to adopt kind of a business incubator model in which if faculty have an idea for a program they would like to do, to use funds available to us to help to seed fund it, to help them locate donors who might be able to help to fund other work they're doing. One of these is a center called Pride, which is a center for youth development and engagement. There's some folks from Pride here. And this is our next foray into this area with a faculty-driven but center cooperating area of research. And I just the idea is so brilliant and so intuitive that I think it will be a remarkable multi-year program of research that will involve a lot of people. So on behalf of the Bronfenbrenner Center, welcome, and you can consider yourselves to be at the kickoff of, we'll look back when the history is written on this very day of Project 2Gen. So thanks very much and enjoy the workshop.
Hi, everyone. I'm Laura Tack. I'm an assistant professor in policy analysis and management in the Department of our College of Human Ecology. Before I start with the official formal introductions of our all-star panelists here, I just want to let you know if you're coming in the back. If you want to file around, there's like some seating on the side, some step seating if it gets too crowded back there. So feel free at any time to kind of file around if you want to try to get a little bit more of a permanent seating back there. So we're really excited to have an amazing group of panelists here to talk to you this afternoon. Each of these panelists has dedicated their professional careers to supporting vulnerable parents and children, but each has done so in a different way, through research, through practice, and through politics and policy. So we're excited to bring all of these different perspectives together at one table here today. And we're also really thrilled at the diversity of perspectives and careers in our audience as well. So we want to extend a special welcome to all of those of you who are attending from off of the Cornell campus. So welcome, and we're excited to have you here. We've asked the panelists to each speak for about 20 minutes about their work, and I'll tell you a little bit about each of the panelists and then let them kind of come up and do their thing. So first we will hear from Lori Severens, who serves as the Assistant Director for Leadership and Design at Ascend, a program of the Aspen Institute. Lori is going to talk about the growing movement around two-generation approaches to supporting vulnerable families and all of the work that's occurring in this domain in research, policy, and practice across the country. We're then going to hear from two really top-notch scholars who are doing cutting-edge work on programs and policies that help to support mobility from poverty in a variety of different ways. Lindsay Chase-Lansdale is the Associate Provost for Faculty and the Francis Willard Professor of Human Development and Social Policy at Northwestern. And Lindsay is a developmental psychologist by training, and her research addresses family strengths, programs, and policies that can promote successful outcomes for children and parents who are facing economic hardship. And then we'll hear from Lisa Gennetian, who is a research professor in the Institute for Human Development and Social Change at NYU. Lisa's research portfolio spans poverty and policy research, income security, education, and early child care, with a lens towards identifying causal mechanisms for policy action. In 2015, she launched the BELL Initiative, which applies insights from behavioral economics to support parent engagement and enhance the impacts of early childhood interventions. Lisa is also a Cornell alum. She got her PhD in economics here, so we welcome her back to campus. And then finally, we're very excited to welcome our very own Mayor Svante Myrick to reflect on all of the exciting work that's happening locally to support vulnerable families and children. As many of you know, Mayor Myrick has a deep understanding of the needs of the residents in our community, and he's a passionate advocate for Ithaca's youth. He is also, of course, a graduate of Cornell, so we're delighted to welcome him back for this event. And because he does have a city to run, he's going to have to step out just a couple of minutes early from our event, but we're very excited that he was able to make the time to be here today. After we hear from our four panelists, we'll have a question and answer period that will be moderated by Jennifer Tiffany. Jen is the Executive Director of Cornell Cooperative Extension's New York City's program office, and she's also the Director for Outreach and Community Engagement at the Bronfenbrenner Center. And in those roles, Jen has worked tirelessly to develop and implement programming that supports vulnerable parents and children throughout New York. So without further ado, I will invite Lori Severens up to kick things off for us.
It is a pleasure to be here. I want to thank Professors Donovan and Tack for inviting me, and it's an honor to be here with Lisa and Lindsay, whose work has informed so much of the work that we do at the Aspen Institute. And Lindsay also was one of our inaugural two-generation fellows at the Aspen Institute, and she was brave enough to hop on board the plane as we were both flying and building it at the same time. And I just learned that Mayor Myrick is a Rodell Fellow at the Aspen Institute, which is also really exciting, really important investment in public leadership, so thank you. So my role is to tell you a little bit about the foundational elements of the two-generation approach and the momentum across the country. One of my favorite speakers is Chimamanda Ngozi Adichie, and she said that the danger of a single story is that it creates stereotypes. And the problem with stereotypes is not that they're untrue, but that they are incomplete. And what I think is so important about the two-generation approach is that it really looks at each family and the richness of those families. And it tries to dive down below the stereotypes that we all hold in some form or another about what it means to be family and what it means to disrupt the cycle of poverty. When we look at two-generation approaches, we, in partnership with the field, and when I say we, I mean the Aspen Institute, have looked at 5 principles that we think undergird those approaches. And I'm not going to go through all of them, but I wanted to go through 3 of them. The first one is about articulating and being accountable for outcomes for both children and the adults in their lives together. As Lindsay and Lisa can tell you, the two-generation approach is not a new concept. It dates back to things like the settlement houses in Chicago and in New York. It dates back to Head Start, which Yuri Brofenbrenner is such a part of conceiving. But what we're really looking at now is how are we truly considering what are the goals for the child and the adult in their life together. It's not about a really fabulous, high-quality early childhood program with a referral pamphlet to the parent at a work center. It's really thinking about what are the goals for the whole family and being accountable for that. The second principle that I'd like to talk about is about engaging the voices of parents. The other thing that Chimamanda Adichie says is that power is not just the ability to tell the story of someone else, but it's the ability to make that story the definitive story of that person. So when we design two-generation programs or policies, we have to have parents at the table. It's their experience, their resilience that makes the program successful. They're the experts in their own lives, and nothing any of us thinks or researches or does can change that fact. We've seen some wonderful programs that have realized they were going way down the wrong track by not engaging parents. For example, in Colorado, working with immigrant communities, the Valley Settlement Project was realizing that there was a high degree of English illiteracy in the parents they were working with, and they wanted to get those parents engaged in their classrooms with their children. So they decided to do English as a second language program. Makes perfect sense, but they weren't getting any uptake, and the program was failing. They started talking to parents, and they realized that a lot of these parents hadn't had formal Spanish linguistic instruction, so trying to make that jump to then learning English wasn't working, and they were losing confidence in their own ability to learn. And so by making that switch to actually working with the parents in Spanish instead, the degree of parents' confidence in their own learning trajectory, and then what that means for their kids and their confidence as their children's first and best teacher, rose dramatically. The third principle is equity. I don't think anybody in this room would disagree that no child should be defined by their zip code. Yet in far too many of our communities, that's exactly what's happening. Research by Raj Chetty and others, and all of us from many of our own observations can tell you that far too many children are suffering from the systems instead of being supported and buoyed up. And the same is true for families. So those are 3 of the principles that we think about in designing two-generation programs and policies: being accountable for outcomes for both children and the adults in their lives, engaging the voices of families, and really looking at what it means to achieve equity through our programs. So what is a two-generation approach? Some of you in the room may be familiar with it, but I'm going to give you a brief overview, and I hope those of you who are familiar will bear with me. When we think about a two-generation approach, we think about a mindset. And in that, it's not a program. It is a mindset of thinking about how you align services for children and the adults in their lives together. And we think about 5 components. And these are the 5 components that any family needs, that my family needs, that your family needs, that every family needs to be successful. We think about high-quality early childhood learning and educational experiences for children so that they're ready to enter kindergarten, so that they're reading on grade level by 3rd grade. And we know from research from Jim Heckman and many others that that investment early on has a 13-to-1 return on investment over the child's lifetime and to society. We think about the pathways for parents, their post-secondary education, their track to a good job or career job, not just any job. We look at the wraparound supports for families, the economic assets, financial literacy, transportation, housing. You can't take a child out of any of that or a family out of that, and if those elements aren't in place for a family, even all the other investments we make, they're still going to be at risk of being unstable. Something that Lindsay's class of fellows helped us build up was really the importance of health and well-being. Mental health, physical health, emotional health for families. Health is one of the biggest factors in a family's ability to thrive financially because of time away from work, the ability to focus, the ability to maintain the lifestyle, and the stability that they want for themselves and their kids. It's kind of exciting, actually, in New York City recently, the Department for Children's Services has just renamed itself the Department for Child and Family Wellbeing with that kind of thought process behind it. And then finally, the last thing that we call the secret sauce is social capital. Those are those networks that we all rely on every day. It's the friend who's picking my son up from soccer practice because I'm here and not there. It is the colleague who told me that there was an opening at the Aspen Institute, so I could look into that as a job possibility for me. It is the person who helps you get your kid to school in the morning. All of those people that all of us have in our lives are critically important, but in some of our communities there isn't the trust in those types of supports, particularly if you don't live near family. So those are both the principles that undergird the two-generation approach and the 5 components that we look at when we're thinking about that approach. And I should say that when you're looking into that approach, and I think some of the projects that you were all investing in show this, not every program can do all of these things, nor would we expect them to. In most cases, it's not to say they wouldn't necessarily do it particularly well. What is really important about it is the alignment and partnership, so that those who are really good at early childhood can do that, and those who are really good about thinking about adult pathways can do that too, and then it's about partnership. So it's about letting go of egos, it's about communication, it's about aligning around the entire family. And what we're seeing is that this approach is taking off across the country. At the federal level, under the last administration, we had White House pilot projects in 10 states across the country. We had Department of Labor strengthening families initiatives in a number of states. And today we have the Department of Education, which has embedded a two-generation approach into its procurement and its policies, so that the staff are putting it into the things that they do every day, which is making it a foundational piece in the department. The Administration for Children and Families at the national level has asked all of its regional administrators to do a two-generation scan of all the states that they're responsible for, so they can get a picture of what's happening across the country. At the state level, we know that there are at least 35 states that are taking some form of a two-generation approach. I was in Aspen last week, and we had 14 state teams and a number of counties who were there. And it's everything from looking at different forms of working with non-custodial parents in Colorado, to aligning data systems in Georgia, to Tennessee. They've invested in training their entire staff from the 4,000 frontline folks that work with their families to the leadership to think about how do you think about families holistically, how do you think about families from a strength-based perspectives, so that you treat them as the leaders in their own lives. We also see it at a program and community level. Just within our Aspen Institute network, we have 210 organizations in 41 states in the District of Columbia that are using two-generation approaches. And what's important about that is that they're testing things. This isn't completely tried and true, and we know every proof point along the way. There's lots that we're still learning, and I think that's really important, to be willing to innovate and to learn from the research. But these are organizations that are testing things, they're sharing that information with each other, and they're being candid in many cases about their failures too, so that we can all learn and grow this together. And there is also, at a human level, there's a ton of public will behind it. We, since 2011, have been doing focus groups and polling on an annual or every other year basis. And in 2016, during the elections, in our most recent poll, 84% of the American public, voting public, thinks that two-generation approaches make sense. 74% are still in favor, even if you say it will increase your taxes to do it. Those are pretty huge margins, and in many cases, present company excluded, more popular than the politicians that we're trying to promote this with. And then most importantly, I think families think it makes sense. When we talk to families, this makes sense to them. They know that they can't go to work if their children aren't in safe places. They know that they want to be the kind of role models for their kids that in some cases they wish they had or their parents had been. One of the families that was with us last week said, you know, I became an advocate, and she's a young mom working for the Denver Boys and Girls Club, and she said, I became an advocate when I learned that my story mattered and that my story could create change. And I think that's really important for all of us to remember, that stories do matter, and the stories of every individual family that we're working with matter. And if we keep that front and center, the stories of the children and parents and families that we're trying to work with, I think we'll be all the more successful. Thank you.
This guy. That was great, Laurie. Thank you. It's wonderful to be here. I've just been reminiscing because I was here quite some time ago at a time when, as a developmental psychologist who wanted to learn more about programs and policies, the way you are all experts, I was working in Washington, D.C., both as a fellow in Congress and then for the Society for Research in Child Development. And we got to build a conference here on social policy and children. And now I'm back many years later and very much appreciate being part of the Aspen Institute family and being part of this kickoff. So today, you've heard the big broad overview from Laurie, and I'm going to give you a quick insight into research on a type of 2-gen program, which you can see is called human capital. And I don't have much time, so I'm going to flash up my wonderful research collaborators and just emphasize that this work is a partnership, not only with program providers, policymakers, but also with families. We do a lot of focus groups and interviews to hear what families have to say. And you have to have funding to do research, and here I am thanking the Administration for Children and Family, Ascend, the Kellogg Foundation, and the Foundation for Child Development. So what are these 2-gen human capital programs? It's very much what Laurie said, that it's an intentionality to link child and parent programs in the same family at the same time, which I think our grandmothers could have told us is a really, really good idea. But it's resonating now in the United States, thanks to leaders like you and other people on the panel. So it's education and job training from parents combined with very high quality early childhood education for young children. This is our definition because this is what we're studying. Another key point is to have it be equal intensity, and we'll get back to that in a minute. So why are we here? Here's just one statistic where you can see if you are in the bottom quintile of income, you're in the lowest level of income, there are only 11% of the families have some sort of post-secondary degree. And this makes sense. If you don't have income, you're not going to go to college. If you don't go to college, it's going to be hard to have income. Contrasted to the top quintile, where 53% who either grew up in high income or went to college, no matter what, got a degree. So it's a bidirectional relationship that we're concerned about. This is what we're particularly concerned about, that I know you know on the day-to-day, which is that 67% of low-income children have parents with a high school degree or less. These are children under age 6. Some of this is youth. Parents are going to go on and grow up and get more education. But we have an education problem in the United States for a lot of reasons. So Jean Brooks-Gunn, another wonderful developmental psychologist, I'm very biased in favor of developmental psychologists, and I wrote an article a number of years ago, And we acknowledge that two-generation programs have been around for quite some time. We call the ones that were in the 80s and 90s 1.0, because they had the right idea and they were trying to bring together these programs, but they were often as separate institutions. There wasn't the similar intensity. Childcare was of various types of quality, and there was more a focus on GED and not the necessary post-secondary training that you need now with globalization, with technology, and so forth. So we nicknamed the new ones, which are being studied and fostered now, 2.0, where you have to have high quality, you really need to think long-term, pre-K to third grade for the kids, AA and BA degrees, or a certification that has meaning in the marketplace and links with employers. So as been mentioned, it's not a new idea. I think the settlement houses are a very good point. Head Start really started as a two-gen program. But even though this makes so much sense and we can see it on the day-to-day when we work with families, and we have a lot of research on the role of parents and children, studying and evaluating the impact of two-gen programs, these types of human capital programs, is still in its infancy. And I'm going to tell you about some early findings today. So the question is, does a two-generation approach have a greater effect on parents than Head Start alone? This is how our study's designed. And the long-term plans are to look at kids. So there's a Model 2-Gen program that many of you may have heard about called Career Advance, and it's at the Community Action Project of Tulsa, Oklahoma, called CAP Tulsa. CAP Tulsa is an anti-poverty agency. It does many, many things, but it's a very large Head Start and early Head Start grantee. Serves 2,000 families. And in 2008, started piloting Christopher King, a labor force economist at UT Austin, and Hiro Yoshikawa at NYU, worked with them. So picture this house as the Head Start program. And then you bring in Career Advance, which is the education and job training for parents. And there are all sorts of supports. It's expensive, it's model, it's early, but you have to learn from the best type of program to figure out, well, how could we do this scaled up or less expensively? So you'll see there are career coaches, tuition assistance, financial incentives, and childcare when the Head Start's not in session. Also working with local colleges, schools, employers, and because we're doing post-secondary education, bringing in adult basic ed and English language and GED training if necessary. Another way to look at it is as all these components. So we have a career coach that provides information and support. As has been mentioned, social capital, peers, the parents gain so much from each other. They take classes together and they meet together. Tuition is free at community colleges. There's incentives in terms of financial incentives for completing a certificate or completing college. There's this whole term and workforce training called stackable training, where you can go for a short period of time, get a degree, step out, work, come back in. And also, it's called sector-based. So did an analysis of the marketplace, the job market in Tulsa, to see that healthcare is where the training should be. And so this is this whole career ladder where you can start at certified nursing assistant, CNA at the bottom, and work all the way up to registered nurse. The view is that parents are an asset. They know what they need. They have already gotten their kids to Head Start. They are motivated on behalf of their children. It's a trusted community, and the family support staff reach out to parents. And the whole idea is to recruit parents out of Head Start rather than just generally from the community, which is the case of most workforce programs. So here's our study. It's called quasi-experimental because it's not a randomized controlled trial where we took a wait list and randomly assigned people to the program and a control. The parents are recruited into job training, Career Advance, and then they are matched to other parents whose kids are in CAP's Head Start program, but they're not in Career Advance, the job training. It's a longitudinal study, and I'm presenting the first year findings today. We did this through propensity score matching, and we even matched on motivation, whether you really wanted to go back to school and you wanted to work in healthcare. It's about 258 people, 140 in the job training Career Advance program, 118 in the control group. You can see most are women, single parent, age range is quite broad with a mean of 29 and an income of about $15,000, primarily African American and white, some Latino families, and people had tried education before. People really want education. So here's our outcome measures or focuses. What happens to parents' education and employment 1 year later? How about their psychological well-being? And how about their kids' Head Start attendance? So first of all, we found that career advanced participants have much higher certification rates than the comparison group. You can see it's 62% complete a certificate within 1 year compared to 3% in the comparison group. And remember, it's a very, very similar comparison group. This is a big finding because most other programs out in the country which have drawn on these new ideas for job training, coaches, peer supports, are being more successful than they were in the past, but the ranges of certification are approximately 25% to 45%. So we're quite happy about this. In terms of healthcare employment, again, a higher rate. Look over to the right, 52% are employed in the healthcare sector, and that's what they're being trained for, versus the comparison group, 30%. But interestingly, if you just look at employment in general, get a job, any job, it's very similar between the two groups. So again, targeting sectoral analysis and targeting job training is an innovation in the workforce world. This is very interesting. If you go back to school, you usually have to cut back your work hours. So indeed, our parents in the training program have decreased earnings of almost $2,000. But because of the incentives for completion and in-kind assistance and wraparound childcare and so forth, there's somewhat of a trade-off, so there's not as much stress. In addition, being a psychologist, I'm very happy about these findings. These are effect sizes, which you should just look at these numbers to see, are these impacts meaningful? And in terms of their sizes, it's seen as modest to moderate impacts. So what's going on is parents in career advance have higher levels of commitment to work and career. And we have a measure of career identity. And so an example of an item would be, I'm planning for and succeeding in my career is my primary concern. There are 10 types of items on a questionnaire in an interview like that. So that's the first one. The second one is self-efficacy, which is obvious, agency, sense of being in control of your life. And again, we have much higher rates for the experimental group or the program group. So an example would be they check, I strongly disagree with, I am meeting goals that I have set for myself. Or there are lots of ways around problems. And then the third positive impact, optimism, is a greater hope for the future. And if you rated low on if something's going to go wrong, it's going to happen to me, you would have rated that no, I strongly disagree, or I believe that things will be positive, and in uncertain times, I will be successful. So a sense of agency, optimism, and commitment to career. And then lastly, I'm also very taken by this finding. They do not report higher levels of stress. It is hard to go back to work, raise children, stay in work, go back to school, raise children, and face economic hardship. And we have our families not reporting higher levels of distress. One type of stress is feeling like the world is unpredictable and uncontrollable. And another type that we measured is just more related to mental health issues like anxiety and depression. So, for example, you see we just don't get any difference there. And this is big because two types of programs that have worked on the same population in the past, New Chance and the Early Head Start program, found higher levels of stress on the part of the young people, the young parents taking the job training. And then last but not least, we have higher levels of Head Start attendance and lower levels of chronic absence. So now I have to play for you, hoping that I don't have the 5-minute warning.
I like how they've made the program fit around the youngest child's schedule. The child that's in the Head Start program, how they've tailored it to fit around those hours, which really would tailor around all school-age children's hours. So only during clinical times, do you have to really worry about before and after care? But for the most part, all of us can still take the kids, kiss them goodbye, do our thing, and then be there to pick them up.
And then peer support, as I mentioned, and I love this little thing here. Where are you? Oh, shoot, just a sec. It worked great.
I know if I tried to leave this program, I would have some people on my phone. I know, and that's the good thing about us being, that's the one good thing about us, about it being a small group of people. If one of us tried to leave it, oh, we're gonna be on that phone quick. Wait a minute, what are you doing?
So this was a focus group, and they do take classes together, and they meet with their coach together. So there's enormous peer support. And the same woman said, you know, when I dropped out of college before, nobody cared. It was just me against the world.
I took it like twice and I could never pass it. And I just felt so dumb that I was like, there's no need for me to take the GED test. How hard is it to take the GED test and I can't fail it? So I must be dumb. And I just kept feeling that way. I wouldn't give up. But my career coaches and instructor, don't give up. Never give up. And I'm not a give upper. I like to challenge myself. And they talk and talk to me and just take your time. Cause I like to rush also. And that was my problem. I want to get it done. So I stayed there for a while. And I took it the third time and there it went. I passed it. I decided it would just take my time.
And then I have to show you this. So how are children being affected? The idea is parents who go back to school, the theory is learn more, read at home more, maybe do homework together, talk more, have a sense of the understanding of the education system, can oversee their children better, and also over time, will increase the richness of the environment and set expectations and help their children meet them. That's the theory. We're in the middle and in the early part of doing it. The second part is if you get better education and you get more income, your stress may go down and your parenting may be more responsive and attuned to the child. So we're testing the kids in all sorts of ways, but this is my favorite measure, which is adapted from the Kellens, where we want to understand how do children see what's going on when their parents go back to school.
My mom goes to school. My mom does not go to school. My mom goes to school too. What does your mom go to school for?
So she can get her degree.
So she can get her degree? Okay.
In the nursing program.
In the nursing program? Okay. Why does your mom go to school?
Because so she can learn.
So she can learn? Okay. I like it that my mom goes to school. I do not like it that my mom goes to school. I don't like it either. Why don't you like it?
Because I don't get to see her that much.
Oh, okay.
I like it that my mom has a job. I do not like it that my mom has a job. I like it that my mom has a job too. Why do you like it that your mom has a job?
Because it's important that I need to go to school and that she needs to go to school and I need to work at school and she needs to work at her school and job.
Okay.
So you can see in that we are going to test child outcomes next year because we believe these are inputs going on. It takes a while for home to change. And there could be some initial negative impacts if children are feeling that, that they don't get to see their mom. So very quickly, the limitations for us are that we're recruiting from Head Start. We add this job training, and we're comparing to Head Start only. So others could come along in the research world and say, well, wait a minute, what about recruiting from a community job training program and adding Head Start to that? So we're actually doing a study along those lines too, to have the comparison group be Head Start only or job training only. So I'm ending by saying that this holds great promise. I know that you're experiencing this every day in the Extension Service and what's going on in New York State and Ithaca locally. We have to do a lot of longitudinal follow-up. We need more information on the children. But model programs are expensive and they need to be scaled up. So I'd like to close with saying I'm very delighted to be here, and I believe there's significant momentum in practice, policy, and research. Thank you.
It is so great to be here, and thank you for arranging the gray skies. I was missing them down in Manhattan. Actually, the timing couldn't have been better. The work that I'm going to talk, I was asked to talk about behavioral perspective on two-generation programs, which is not work I've actually done, but I've done related work. And the timing is incredible because, as many of you know, Richard Thaler just won the Nobel Prize in Economics, and he taught at Cornell for many years. And while I was here at Cornell, one of the students that he taught was Sendhil Mullainathan, who has done a lot of work in this area and thinking about the context of poverty. And Sendhil and I spent a lot of time together a few years ago, and it was a depressing moment for me when I learned that he was actually, as an undergrad, first year in one of my graduate student courses. So that was sort of a humbling experience. So I'm really thrilled to talk about this, and I think, thank you, Rachel and Laura, for bringing us together. We did not plan this, but I'm hoping that there are threads in my portion of the talk that kind of pull together both what Lori was saying and the terrific and exciting results that Lindsay was pulling together on an actual program. Okay. So I'm going to spend some time kind of setting up the theoretical backdrop of thinking about the application and the framework of behavioral economics and sort of what it can do for us in innovation around design and how it can really help kind of push forward even a little bit more the kinds of programs and services being designed now, right, in a two-generation perspective. I think of parents as decision makers. I've been recently thinking about the term change makers and change agents, and you'll see that kind of filtered throughout some of the things I'm going to talk about. And I'm really excited to be thinking about how to expand this to the two-generation framework and welcome all of you to do that thinking along with me. This is a wide open, kind of at the frontiers type of field, so very ripe for innovation all around. And then I'm going to show you some applications just to ground it in what you can actually do, again, through the many extension services, and I know there are a lot of practitioners in the audience. And this work is very amenable to working together and learning very quickly about what works and what doesn't work. So let me start with the tale of two Marias. Here is Maria and her partner and their son. And note several things about this snapshot, this picture. Engaged, attentive, dressed pretty well, really nice game, interactive, focused. Whoa, okay. I lost the, sorry, I lost the picture on the laptop here, so I can't see what I'm talking about. Yeah, okay. Cool, I could do that. Can I use this? Sorry. Okay, anyway, back to Maria. Okay, so my claim is with Maria and this snapshot. Ta-da! Okay, there she is. Now I'm really worried about going through that presentation, but let's do this. Often what we're doing when we're thinking about services and programs from a developing perspective is this is kind of what we're after, right? We're after a scenario where two parents or each multiple adults in a child's life are engaged, are providing all of the things that a child needs, all the way from the responsive parenting to the structural needs. And by doing that, we often lose sight of what parents are actually already doing and how we can design programs to really capitalize, going back to the term that Lindsay already posed for us, thinking about parents as assets, right? And so this framework that we can bring from behavioral economics gets us back grounded in that scenario. So keep Maria in mind while I'm talking. Let's remember what we're asking parents. This is again from what do parents need perspective, coming from our best knowledge, our best evidence, what we know has worked and hasn't worked in the past. It takes working memory, emotional regulation, grit, humor, structural support, financial resources, healthy adult relationships, balanced mental health. It's a lot. And I call out to Sarah Watamura at University of Denver to kind of describe the spectrum of socio-emotional strength, psychological strength, and all the sort of capacity to do and support all the economic resources all at the same time. What is the reality? This is extreme, but there are elements of the second Maria in all the Marias, the first idealized Maria, right? Un- or underemployment, unpredictable work hours, little wage growth, very little economic mobility, limited family support, usually no savings, limited insurance, patchwork childcare, no stable partner. So how do we reconcile what we know we should build, what we know, and we think we know, what parents need based on our best science, with what they actually have and what they actually want? They all want what's best for their parents. And this is where this framework can help fill this gap. So we're all using stories. It's a powerful mechanism to keep us, I think, grounded as scientists, but also to bring back kind of the voices of the parents. So the second Maria is a parent of 4-year-old boy, Aaron. She works at a job with long and stable hours. Her life is busy, but she's excited that Aaron is in Head Start this year. No coordination with Lindsay. The family coordinator at Aaron's Head Start program invited Maria to participate in a parent program. She's not sure whether she needs to attend because, to be frank, Aaron does not have problems. She's concerned that her family and friends may judge her if she participates in a parent program. The deadline to sign up was last week. She's not sure if she needs to sign up. She's not even sure whether she has time to participate given her changing work schedule and the new training she's trying to get for a better job. So what behavioral economics does is it takes some of the tools that we often rely on, whether implicitly or explicitly, in designing our programs and assuming how parents are making decisions, right? So conventional economics will say, Maria will weigh all costs and benefits, she's fully informed, and her preferences are pretty stable. Behavioral economics takes us a step further, a little bit smarter, a little more grounded in the reality of what influences our day-to-day lives and in the context in which we're making decisions, and says Maria will also be distracted, she will put more weight on the present versus the future, and she will be influenced by others. In fact, you heard some of those themes in exactly what Lindsay was presenting. So the interdisciplinary framework of behavioral economics brings two worlds together, right? So conventional economic theory, stable, well-informed preferences, self-interested behavior, comparing costs with benefits, blended with social psychology that thinks about our minds as muscles, where we lose and gain self-control and attention on a day-to-day basis. Sometimes there's a gap between our intentions and our actions. You heard a little bit of this earlier too, parents being very well motivated but having some trouble following through. Social influences. And the thing that's powerful about bringing these two theories together is the levers you have now to work with. Your toolbox has suddenly doubled, okay? So economics would say that prices drive our behavior. We know that does, we have literature that does. We move when we see things cost different amounts. Okay, social psychology would say there's other things that also drive our behavior that are things that we can change and design. We can change how the context is being faced and the circumstances being faced by individuals. We can change how our choice sets are being designed. We can design cues and we can develop anchors. I'm gonna give you some examples of these. How we think about barriers also is very much affected by the lens that we bring, right, in our theory that we bring to families in the context of any program, including two-generation approaches. So with conventional economic theory, when we see that people are not using resources, or we think hard about how to maximize access to resources, we often go down the road of thinking about, I'm gonna call them structural barriers, right? We think they can't afford it, so that's where we get into the world of subsidies. We think other children need to be cared for, so that's when we think about childcare for siblings. We think about the difficulties with getting into the program, right? And that's where we get information pamphlets. Social psychology will, again, expand that set of barriers to think about stigma and judgment, like the example I gave you before, misestimation of benefits, and pure procrastination. But the beauty here is now you've got lots of things and lots of tools to address those barriers, right? You can provide transportation, you can provide childcare, you can provide food. You can also think about how to affirm identity. You can think about how to make benefits, quantify it somehow that's more easily brought to the future, to the present, so you reduce the amount of kind of calculation that someone has to make about future benefits. You can also alter choice sets. So I mentioned Sendel. The behavioral economic framework also changes how to think about poverty. So we are conventionally sort of taught, and again, the disciplines that we bring to thinking about poverty often tends to go into the kind of the position of choices people make, okay? So people chose to live in bad neighborhoods, people chose to not get an education, people somehow chose to have a child when they were a teen, and so the solutions often come from that perspective, right? Place-based solutions, providing teen parenting, teen prevention programs. What the behavioral economics lens says is it recognizes that there's something else about living in poverty that is not about all the rational choices that people have made, okay? It recognizes that the mind itself becomes quite constrained in terms of its resources in the context of poverty, that there's a tendency to focus on families' immediate needs, so this is sort of the concept of tunneling, that there is cognitive drain related to everyday financial juggling of resources, leaving very little room to think about other things, including reading and talking to your child on a day-to-day basis. And there's also stigma, so being treated with disrespect and disregard. So what that means for the second Maria is that there's very little cushion, okay? So one slip, and that could be something as simple as missing an appointment, and you can quickly see how this quickly spirals into poverty and makes it really difficult to subsequently get out of poverty. So being in a two-generation lens, I think has some really interesting theoretical implications that I didn't spend that much time kind of fleshing out for the talk today, but I think this is sort of promising. So with colleagues, Larry Aber and a colleague from an organization called Ideas 42, Matt Darling, we had been thinking about how to apply this to child development. And you can see here, when you start thinking about parents having a resource called attention, you can imagine thinking, and in the context of poverty, that attention being particularly constrained, you can think about how to apply some of these strategies in this framework to freeing up parents' attention. And that freed up attention in this model would therefore leave more resources to spend time with the child and to engage in a really responsive, interactive way, which would then be predicted to improve children's cognitive development. You can also imagine that at the same time, those efforts to free up parents' attention could also free them up to engage in their homework, or to engage in a job training program, or to show up at a job on time. So this framework, I think, offers a lot to think about in the context of both supporting the parents and their efforts to improve their economic mobility, as well as in supporting their children's development. Okay, so recently I've been trying to apply these insights more directly into the context of early childhood interventions from the perspective of parent engagement. And I have the N2 generation approaches because I do see this very much moving in that direction, just haven't had the opportunity to really work deeply in two-generation models quite yet. So I'm gonna give you a flavor of this work. It's gonna feel a little fast because I'm not gonna have that much time. But just a little kind of advertising, there's gonna be a webinar on Thursday that will talk about this in more detail, hosted by the Society for Research in Child Development. Okay, so this work in Bell applies these concepts from behavioral economics, a decision-making framework, to enhance and optimize the impact, right, of early childhood interventions. We've been doing a lot of work within existing early intervention and public health platforms and data in New York City. And one of the neat research components of this is its rapid fire experimentation. Okay, so we can get results really quickly, evaluate, redesign, and retest. The designs are also inherently implemented in a way that would be easy to scale. Okay, so the model is very practitioner friendly. How we start is thinking about theories of change and really isolating those key decision-making points. So going back to Maria as the change agent means she's also the decision maker, right? On behalf of what she's doing, as well as where her child is going to go, what her child is doing on a day-to-day basis. And so what we think a lot about is where are these key decision-making points and how can we use these tools from behavioral economics to facilitate kind of follow through and to facilitate parents kind of delivering on what they want to do for themselves and for their children. I'm going to give you 3 quick snapshots of how we've been thinking about doing this. So this is a theory of change model in the context of a home visiting program and how to integrate that with early learning resources. And you see here the real point of decision-making focus is on take-up. So you think about things like Reach Out and Read and text-based early learning resources that are libraries that are out there in communities. How can we address that bottleneck and increase take-up of those resources? The second example is a school-home play-based program that was implemented in Head Start. Blue is what's supposed to happen at school and white is what's supposed to happen at home. This was a really nice portable curriculum where children are getting similar activities wherever they are. And here, again, we were really focused on whether teachers and parents were on the same page on what the activities were and how to use them on a day-to-day basis, and kind of practicing them at home. And yet another example is a parent program that is built out of a school-based setting. And here, which reminded me a lot of what you were talking about the Head Start programs in terms of building relationships and communities within schools that are kind of sprung and spawned off of the children who attend the schools. And here our focus is, how to get parents to engage, how to show up at that first kind of parent program and meet the other parents. And from there, the theory is they will want to come back again. Some examples of what we've done. Parents misestimate. And one of the things that we've developed is a feedback mechanism. If you ask a parent how long they've spent reading to a child, they will often tell you a number. It's rarely 0. But the number is often also not quite close to the accuracy of how much time they spent. We all do this. And what you see is when parents get real information about how much time they spent with their child, it actually has quite a reinforcing effect, right? So it's calibrating their reporting and their thought process about how much time into real numbers. So we developed this feedback form, handed it to parents during a parent-teacher conference, confidentially. Teachers didn't see what was in this envelope. And what we saw after seeing, this is how much I reported that I was spending time with my child, the parents were incrementally increasing, right, the time they spent with the child. So this is an example of recalibrating for parents. In our home visiting program, we tried implementing some affirmations. So the idea here is parents juggle multiple identities. We presume that parents are wearing the nurturing mother hat at the time in which we want them to engage in programs, that they're arriving at programs ready to act like a parent, or in the case of workforce, they're arriving at programs ready to shed the past and ready to put on their identity as a worker. We can make that much easier for them, right, by something called affirmations. And we do this in a second home visit. There's a script. We show them a video at the same time about showing them how parents are interacting with babies in a very kind of light touch, low cost way. The third sort of tenet I talked about is choices. And so it's something about our political system as well as we want to protect and preserve parental choice. This is sort of a tenet that's throughout a lot of our, at least, federal policies. But often too many choices can lead to the opposite outcome, right? It can lead to inertia. And we have not thought very carefully about what this means when we're even presenting options to parents in voluntary programs. And there are things that we can do that completely protect parental choice, but are designed in a way to help minimize the effects of inertia. One example is changing a sign-up form in the traditional way that you'll see on the left-hand side. So this is very kind of passive sign-up to what we would call an active choice, okay? And the thing that changes, the dramatic change here, is being very explicit about attending and not attending, right? And making that very clear to a person. When you do this kind of change, you see dramatic differences in other domains. We don't quite know what happens in parenting, but in the context of things like flu shots, throughout the health domain, we see a big change in behavior. Okay, I'm running out of time, so here's where I will try to end. So these behavioral insights offer a brand new tool set. They can help transform our thinking about how we're designing existing programs and services. I would like it to transform our thinking about how we're even designing them from the ground up, and being really smart about kind of the psychological, social psychological, as well as economic factors that move people. We know a lot more about how humans react to their contexts, and we should be using them in our design of programs and services. Using this kind of tools, we can transform things like a flyer that we've all used a million times and convert it into an invitation. And doing small things like this can have dramatic, dramatic effects. So this is real data from one of our programs where they were very focused on getting parents to these workshops. You see it, so this is the group that got the flyer, the control group, for 7 or 8 different workshops throughout the year. And the difference we got from sending them a set of reminder messages as well as some personalized invitations. So these are like the first order kind of behavior change we need to see so we can see the spiraling effects that we hope and we anticipate, right, on their children's development. So getting the most from early childhood into generation investments, webinar this Thursday. I know how to do this very quickly. Thank you very much. Just put this up. Yeah.
Made me nervous. I thought she was putting on a new PowerPoint. I was like, I didn't send a PowerPoint. It was like every nightmare I ever had from college all coming true. And it is great to be back here at my alma mater. And to hear such lucid and intelligent, I should have gone to class more often because this was, especially a presentation about the context of poverty and as a mindset, how it can produce things like pure procrastination, which was my major in undergrad. And it is a pleasure to see so many folks here who are doing this work, who are putting this research into action, folks on the Child Development Council, and I saw Carl from AFCU, Carl Graham, and from Cornell Cooperative Extension, Megan and the gang. It's good to see so many people here who are working to disrupt intergenerational poverty, working to change people's lives. It's important to me. I think that Ithaca is better than some communities, and I'm going to talk about the ways in which we've tried to do better, especially during my administration. But we are not perfect. We still have our issues. We have, does anybody want to guess? Single mothers who have children under the age of 5. Single mothers under the age of 5. In the city of Ithaca, what percentage of those mothers do you think are living in poverty? 60 is a good guess. 60% living in poverty? 90%. Somebody's cheating from the Child Development Council is cheating. It's 100%. 100% of single mothers whose oldest child is under the age of 5 in our city, our city in which we are right now, on this beautiful campus, are living in poverty. And that breaks my heart because I feel responsible, and it breaks my heart because I know what that's like. I'll tell you a bit about myself. You may know that I was one of those children who lived in poverty, that my mother lost her job when she was 2 months pregnant with me because she was a short order cook, right? So I was too close to the stove. I cost her job. And she didn't have, there were no protections, right? So she didn't have paid family leave. And my father had left the month before. It's 1987. He was in Tampa. He was in the Navy where he found drugs. Drugs found him. And he disappeared with the last rent check. So when I was born, and I was actually a blue baby, which is when your umbilical cord is wrapped around your, yeah, I know. It's, do you know blue baby? It's how when the umbilical cord is wrapped around your neck and your head comes out really big and blue. It's how you end up very smart and charming. That's what I believe. My brothers will tell you something different, but that's what I believe. So we had to stay in the hospital for a couple weeks after that. So when we finally came home from the hospital, we came home to a red eviction notice on our door. And all of our belongings were on the sidewalk. So I lived the first 6 months of my life in a homeless shelter, the first 8 years of my life in and out of homelessness. And my mother worked 2 jobs. She now mercifully only has to work 1 job because all those kids are out of the house. And we stopped eating up all of her food. But 2 jobs at a minimum wage, both as a cook and working as a maid in a hotel. And I can't tell you how reassuring it is to see that our experience is so grounded and centered in your research. You know, from somebody who, the little kid even looked like me up there. When I was a little kid, he looked just like me. I hope he ages better than I have. To know that our stories are at the center of what you're doing. And I can tell you, in my own limited understanding, not being a grade student, but my own limited understanding of your presentations is to say that you are spot on. You are exactly in the right place. And so many people in this room are exactly in the right place in the work they are doing. Some of the folks here have helped us make progress on that all-important triangle of housing, transportation, and economic opportunity. Without any one leg of the triangle, you will not have success in disrupting the cycle of poverty. Right, that's pretty obvious, right? I mean, if you have a community in which people can find good-paying jobs, but they cannot afford to live near those good-paying jobs, then people will not be able to climb out of poverty. Right? If they can find an affordable place to live, and it's near a good-paying job, but they have no way to get to that job, they will not be able to climb out of poverty. Right? If you take any one leg out, if you have an affordable place to live, and it's easy to get around, but there's no economic driver to get to, you cannot disrupt the cycle of poverty. And we have made great strides. In the last 6 years, so I would say the largest problem in the city of Ithaca is the affordable housing. Right? We've got a pretty good job market, fairly good transportation, but I'll get into that too. But the housing is the biggest problem. And it's a problem at every economic strata, but of course, whenever everybody has a problem, who has the problem the worst? The poorest people, right? So everybody's had the problem from the year 2000 until the year 2012, which is when I was sworn in as mayor. The average rent in the city of Ithaca went up from $500 a month to $912 a month. So it almost doubled in 12 years. And it's even higher now. It's somewhere around, it depends, but it's somewhere around $1,000 a month. What does that mean and why did that happen? The largest reason, it's sort of complicated, but the largest reason it happened is because our economic engine kept growing. We now have 70,000 jobs in our county. 70,000 jobs. This is in a county of 100,000 people, right? And you might think that means 30,000 people are unemployed. Not so, right? Because half the people in the county are either retired or too young to work, right? About another 20,000 are students. So you got 30,000 people of working age living in the county for 70,000 jobs. Where's everybody else coming from? Outside the county. And as our economy grew and grew, we didn't add new housing. We have 30,000, when I took office in 2012, we had 30,000 bedrooms in Ithaca, 30,000 bedrooms. Do you know how many bedrooms we had in 1960? 30,000 bedrooms. 30,000 bedrooms. It was a net 0% change. Now the suburbs grew. The town of Ithaca went from about 1,000 people to about 22,000 people. That accounts for all the traffic you might have noticed. Anybody notice traffic lately? That is not because one hotel was built downtown. It's because 20,000 people treat the middle of our city as not point A or point C, but point B, the area they need to move through to get where they're going. It's further complicated by a lot of things, including the university's tax-exempt status and the failure of our elected officials at the state and the federal level to change things like the minimum wage and to make sure that everybody pays a fair amount in their tax code and then redistributes it to things like schools, job training programs, et cetera. So what have we done in the last 6 years? Well, we've had a building boom. I don't know, again, how many of you have noticed how much building and housing and construction we've done at every level of the income spectrum. And every level is important because so many of these families are competing right now with college students for rent, right? Homes that used to be single family occupied 70 years ago, 50 years ago, even 20 years ago, have, because the student population continues to grow, but we didn't add new bedrooms, those homes are being bought by landlords, turned over, subletted, and chopped up into student housing. That's not great for the students, it's not good for the working families, it's not good for anybody. So we tried to focus in College Town on developing as much student housing as we can. And I'm sure any of you have lived in College Town right now, have noticed some of that construction. I'm sorry that you will not get to benefit unless you stick around like I did. It's fun, you could stick around. But what that will do is soak up some of the demand and create more opportunities for folks further down the economic ladder. But we're also focusing on the supply side there, building everything from Breckenridge apartments with the Women's Opportunity Center to the new homes at Spencer and Stone Quarry, affordable subsidized units on the north side where the PNC grocery store used to be, the Chartwell House, Magnolia House, the Rescue Mission, the shelter adding beds. I'm forgetting a bunch. Carl, if you can think of any, shout them out. Building new affordable housing projects and building them, and if I could convey any message to you here, is that location matters. Location matters. That if you are serious about disrupting the cycle of poverty, one of the best things you can do is get involved in land use policy. Land use policy is where we put stuff, right? Where we put stuff. Pretty simple concept. Anybody ever play SimCity? Yeah? Some of you? I did not, but funnily enough, I played a lot of Mortal Kombat, but never SimCity. But my understanding of how SimCity works is pretty simple. They say you're in charge of this entire city, you get to be the mayor, and you decide where everything goes. And like, I wish that was what mayor was like, but you decide where everything goes. That's the major power you have in SimCity, right? The school's gonna go here, the factory goes here, the office park goes here, and this is where the housing goes. The most important decisions a local government will make, and again, at the state and federal level, there are other decisions they can make, but if you wanna make an impact in your community, deciding where things go is it. Why? I've moved quite a lot as a kid, and we lived all over, and one of the nicest places I ever lived was outside of Poughkeepsie in a brand new and beautifully built affordable housing project. And it was clean. It was sort of a reaction to what folks thought was the problem with affordable housing, is that it was dirty or in disrepair. So it was clean, it was well taken care of, it was brand new. And it was 6 miles from anything, including the grocery store. Now you want to talk about exhaustion. When you have to walk down the street for 6 miles to a grocery store, and then load up your children with those groceries so they can all walk back together, is it any surprise that at the end of the night, you don't make that extra effort to go out to the night classes, to make sure your children are doing their homework? Right? When you have to jump out of the way of a truck and into a gutter, is it any surprise that you are more concerned about the stigmas attached to respect and disrespect than you are to your own academic achievement? You become branded with these concerns. And so that's why in Ithaca we are focused on improving TCAP, making it something that's, it's already one of the most affordable and best transit systems in the country. But when people move here, they don't take to it because people don't take to bus systems as readily as they take to other forms of mass transit. Why? Because buses are unpredictable. You don't know for sure that it's coming. People like a subway. Why? Because you go down there, you know for sure you're in the station, and you know for sure that that's a train, and you're like, I must be in the right place. How many of you have ever tried to take a bus in a new city? Right? And how many of you have ever been like, I'm either waiting for the bus or I'm standing on the sidewalk, and I'm not sure which it is, and I'm only going to figure it out once I'm late, once I'm already too late for work, right? So we've tried to we've now installed GPS monitors on every single TCAP bus that you can now track on your phone, and on our most used bus stops in the city, you'll now see maps and screens telling you when the next bus is going to approach, and we want to expand that system. We've invested in Gadabout, so that people, if they miss their last bus home, a lot of people, the reason they won't use the bus is they're afraid, what if they miss it? How am I ever going to be able to get home? We've invested more money than we ever have in our sidewalk policy. How do we do this? Basically by socializing sidewalks. They used to be the responsibility of the person. I'm not going to bore you with this. If there are any engineers who want to hear about it, though, please let me know because I'm very excited about it. It's one of the things I've done that I'm most proudest of. Because we've now built 3 times as much, repaired and built 3 times as much sidewalk each year as we ever did in the years before, all while lowering the cost to the average homeowner, which is very exciting. Bike lanes. One of the reasons I have to leave you now is because the cheapest, most convenient, most affordable way to get around is on a bicycle. But if you do not have the infrastructure, average people cannot use bicycles to get around, especially in the Northeast. So we've been trying to build more bike lanes. If you want to become unpopular in a hurry, build more bike lanes. It's people don't like it until it's done, but we've got to get it done, which is why I have to leave here in a few minutes. Building those transit links is important to me because I know part of the reason I was able to succeed, all 3 of my siblings were able to make it to college, is because my mother could stay at work during her second job and know that we were going to be able to make it to soccer practice and back. We were going to be able to stay after to participate in the debate club. We were going to be able to participate in the life of the community without spending hours in a car, without relying on that car to get there. If you ever have a chance to speak to some of the women at Magnolia House or some of the families in the rescue mission, you will be surprised, or maybe you won't, given the audience I'm talking to, how many of their stories begin with a broken axle or a failed transmission. That meant they missed 2 days of work because they didn't have $1,000 to fix it. Because they missed those 2 days of work, they lost their job. So even things like ride-sharing apps like Lyft and Uber, things that we associate with people of means, where a ride can cost you $7, $8, $9, more money than my mom would make in an entire hour, can still be important stopgaps, right? Because when is it a rational choice? Let's talk about rational economic choices versus more contextualized social behavioral choices. When is it a rational choice to spend $11 on an Uber getting home when you only made $9 an hour during your shift? It's if the alternative is losing your job. That's when it's rational. So creating options, creating flexibility, creating choices for people so they can get from this area to the next. That's what it's about. And finally, I want to talk about those economic opportunities themselves. There are people who have lived their entire life in the city of Ithaca and never set foot on Cornell's campus. Their entire lives, never been on Cornell's campus. There are people who've lived on one of the nicest lakes in America and have never gone swimming in it. They've never been on a boat in it. There are folks who walk past right now, the last 3 years, the largest building boom that the city of Ithaca has seen, probably on record. Little Mary Tomlin's looking into that, our city historian. And they've never seen in the construction crews a single face that looked like their face. we've worked hard. Alternatives Federal Credit Union has worked hard. TC Action, the Childhood Development Council. GIAC, the Youth Bureau, have worked hard to create programs like the Hospitality and Employment Training Program, a program that the city runs where we take folks who are between 18 and 35 and either have no high school education, no college education, or a criminal record, and we give them a 6-week certificate training program so that they can be ready to walk into, and when you have that dreaded job interview where they say, have you ever had a job before? And you say, no. And they say, well, you're gonna need 2 years of experience. And you say, how am I supposed to get that experience if you won't give me a job? You can now say, no, I haven't. But this one professor from Cornell taught me how it was to set a table. I learned from the general manager over at the Holiday Inn how important a first impression is. Right. This training program paid, stipended, we pay folks to go to the training program. It's helping people climb out of poverty, disrupt this cycle, and earn enough money for that first and last month's rent that will help them get and keep an apartment in a place that allow them to lift their children up. So I just want to say this, and I am very sorry that I have to run, so I won't be able to take your questions, which I'm sure will be complimentary and laudatory and simple. I wish, as if in Ithaca there was ever a simple question and answer session. So good luck to the three of you. I will just say thank you. Thank you for the work that you do. I ultimately settled in Earlville, New York, where I was in Head Start and where my grandparents would watch us after school. And when my siblings and I all had an opportunity to start working at age 16, where we were all able to be successful because the work that you've done, the research that you've done, to prove that this is not only the big-hearted thing to do, but the hard-headed thing to do, that this is not just compassionate, but it's smart. And the work that all you frontline workers have done for those little kids like me, my sister, and my 2 brothers, to make sure that they all have an opportunity to grow up to be successful salespeople, doctors, lawyers, and even, God forbid, politicians. I am so eternally grateful, so thank you all so much.
Thank you all for this incredible panel. And I thought we were going to be able to catch Svante for a couple of questions. The organizers of this innovated. They decided to crowdsource about 6 questions, so we have those kind of first on the line, and then we'll go to dialogue and discussion and Q&A from the floor. But before we go to either of those places, I wonder if the panelists have any questions or comments to one another. And I think Carrie turned on, if the lights are green, it's working. Yeah. Lisa, it looks like you have something.
Is that on? My only comment is I'm really excited about some of the synergies I just heard today. So we have another chance to get together and keep working on bringing, again, all these threads from practice, program development, and theorizing to kind of, to spark the next generation of 2-generation approaches.
Those are really good words at a project launch. Yeah. Any other comments or questions from the panel to one another?
Yeah, just that I would concur wholeheartedly.
And as I ended my talk, I really believe that we're in a special time of development of programs, policies, research, and a synergy that's very exciting. So I hope today is hopeful, and I'd love to hear your reactions and comments and challenges.
Great. Okay, so the first crowdsourced question has to do with the fade out of positive effects after programs. It's how can positive outcomes that are associated with a 2-gen program be sustained as children grow and age out of the program, such as Head Start or the Nurse Family Partnership? So thoughts on the fade-out effect and preventing it?
In terms of career advance and the Head Start programs in Tulsa, Oklahoma, one reason that the program was started for parents was exactly this concern. And I've written about this too, that it's not fair for the child to be the only change agent in a family. So the child's gone to a wonderful setting in terms of Head Start, and then the family may be stressed, just as you talk about, with scarcity, trying, absolutely motivated for the best outcomes for one's child, but it's just too hard to continue. And then you combine that with being perhaps experiencing racism, being in a very difficult neighborhood, and the school system may not be as strong. So investing in the parents, the idea is, will actually help avoid some of that fade out so that the parents can be in a stronger position for children over time.
If I could add to that, don't have the research base, but from a program perspective, one thing that some programs are trying to is looking at what kinds of partnerships they can make with the school system. So if a child, for example, exits a really strong Head Start program with a wonderful parent component, if they're able to make some relationships with the school system, not that it's the same intensity of service or even of understanding of what the family is going through, but if there is some partnership that says these are some of the places that these children and families have come from, and so that the schools are aware of and supportive of those families in a way they wouldn't normally have been, they're also trying to continue some of the supports and effects for children in that context.
So my only addition here to the two wonderful comments that preceded me is, I think the question of fade out is still sort of a question. We actually have some really surprising, like in the last 5 to 10 years, findings 20, 30 years later, where children who receive some kind of intensive intervention in early childhood, and then another example is the opportunity to move to a lower poverty neighborhood, are showing dramatically improved outcomes later on in terms of their earnings. The thing that kind of there's a little mystery behind this because we don't understand the mechanisms necessarily, like what happened between those first few years of life that didn't happen in the intervening years and then suddenly showed up when they're 20 to 30 years old. And I think that's part of what we have to understand from a research perspective. But fade out, I don't think is a given. There's some evidence that this early infusion, whether it's place-based or if it's an early childhood setting, is showing some results much later down the road.
I was just going to mention the thing that my colleague Jean just got when she talks about this phenomenon. So we know what you're talking about. You may not do so well in school right after early childhood education. She thinks we shouldn't use the word fade out anymore. We should just use, the impacts seem to reduce for a while, but then they emerge again. So just coincidentally, I ran into Jim Heckman in the airport coming here, and he was flying off to an economics conference on children in Scotland. And I told him about the 2Gen conference and the paper, and he said, well, I've got new findings. I'm studying the children of the parents who are now in their 50s who went in the Perry Preschool Project. You may know that he and his colleagues followed the early childhood Perry Preschool kids at age 50. They have better health, lower lipids, and so forth, lower blood pressure. So we need to think even more broadly that it's not just how you're doing on a test score, how you're approaching life, how you're taking care of yourself, and so forth.
Great, thank you. This may be a Lori question. One of the biggest challenges that we often face in implementing 2Gen or whole family programs is the fragmentation of training, expertise, and funding. Some programs, funding, or people focus only on one area, children or parents, not both, education or employment or parenting, but not multiple domains. In your view, what are the best ways that we can overcome and break down these silos?
So I think there are a few things that are happening and need to happen more. I mean, one of it is just perception. Funding streams for a lot of these programs may come down from the federal level and then to the state level, and in many cases they seem to come down in specific silos that are focused on just the child or just the adult. In some of those cases, those silos aren't actually there. So some of it is about being willing to be creative in our thinking and educating program designers and policymakers so that they understand that those funding streams aren't as rigid. But the other thing that we need to keep doing is pushing for flexibility in those funding streams, both from public funding as well as philanthropic funding. We spend a lot of time working with both federal and state leaders as well as philanthropists so that they think about how they build in both flexibility and longer time horizons for a lot of this work, because both of those things are really important.
Great. Yes.
We've been thinking a lot about this too, because it sounds great to Jen, and then how do you really do it, especially if one area of your expertise is say, the child and not the parent, or vice versa. And what I've learned through working with the Community Action Project of Tulsa, CAP Tulsa, is I know you know from every day, it's how you develop relationships with the other organizations or the various different types of organizations in your community. So just as another example, I was first back to the disappearing findings. It was because of funders who said, you know, I really want to invest so that children can continue. So there was a philanthropist who said, I'd really like to do this job training. And then what we're seeing is in working with the community colleges to provide the healthcare courses, the community colleges are getting excited because they've partnered with CAP Tulsa, they're seeing what's going on, and they're thinking of redesigning their curriculum. So it does take time, but I do think combining and developing relationships makes, you know, a big difference. Then there's other possibilities of doing, I mean, I'm a big fan of waivers of federal funding, so my dream is that there is a significant amount of funding and Head Start funding for family support providers who do wonderful jobs of case management, crisis assistance, referrals, and so forth, and some mental health work, parenting classes, and the like. But one waiver could be, could Head Start programs diversify and use some of this family support funding to have that type of family support person and hire an expert in, in the workforce world and the community college world. So just thinking about flexibility, I was keying off of that, and the building of relationships.
So one program I was just thinking about federal investment is the child care subsidy program. Are you familiar with the inner workings of that, Lori? So I was just thinking about the mindset shift, and you can really think about child care subsidies almost as two generations, especially with the last reauthorization in 2015, where more and more higher portions of that money are supposed to be devoted to high quality settings. But child care subsidies, you know, in its mission are to support employment, right? And so we could, for all intents and purposes, cast it as a two-generation investment. I hadn't thought about that.
Great. Yeah. So in your views, where does the research field need to head? What are some of the major gaps in research knowledge that, you know, that trouble you at night in terms of the intergenerational cycle of poverty?
We don't get any sleep. It's awesome.
Time. I'd like a little more time because I'd really like to see more model programs developed and more investment to try them in different communities, in rural communities, for people from different backgrounds with different types of design. And you know, it's an idealistic way of looking at things, but how else have we learned? Where you try new ideas, you test them, and then you scale them up. So that's where I am right now.
Yeah, I think there's going to be a bias in that direction from my perspective too. I think the most interesting work I've done recently is this behavioral stuff, and it's been most interesting not because the insights are kind of cool and fun to test out, but because they demand this really close partnership with real programs and real people. And it's like a constant testing of, well, can we really implement that? Does that really fit into service? Is this consistent with kind of how clinicians are seeing things happening on the ground? And I don't think there's enough models of that, and at least academia, to do that kind of work, except maybe for here. We're starting to grow one. So I would like to see more of that, sort of the great scientists kind of working with the great practitioners a little more closely, really getting messy on the ground.
And I'm sure the Bronfenbrenner Center knows the whole term of research practice partnerships, and various foundations are supporting these in different communities. And that's where you have a genuine partnership. You learn from one another and develop different research programs that can inform the practice and have it become stronger.
Add one other thing. Lindsay, I think you've done most of the research on this, but really looking at the mutual motivation between children and parents. I think we know anecdotally and through some of your research that there's really a lot to that, but when we think about why these programs are so important, run in tandem, and why they're so effective, I think there's a lot more research that'd be really interesting there as well.
Oh, thank you so much for saying that, because there was something I didn't get to say in my talk, which was that we know these parents are so motivated for their kids. But they've often thought to themselves, well, I had my chance, but I lost it because I didn't finish high school or I didn't finish college, and I'm going to put everything into my kid. And what we're finding is that parents don't understand as much as you might think how much their own education relates to their child's development. And when they start seeing that connection, then they really take off. I mean, you'd think it would be obvious in some ways, but it's not. They're just very focused on their child's experience, and it feels too selfish to, put that motivation toward the child back into oneself. And so helping to see that link just brings it all alive, and then that provides, more support and motivation for a parent who's studying at 9 p.m. or midnight, or, taking time in between non-standard work hours to finish a course.
Relating to that, how do you engage with and incorporate the voices of the families that you're studying and serving?
So we spend a lot of time talking to families. Most of the formats that I've engaged in recently have been focus group formats, and this is a resource question as much as it is about kind of the optimal types of ways to do this. A lot of the work I've been recently doing too actually involve transmitting messages through texting mechanism, and that's been interesting because once parents trust the texting kind of mechanism and who they're communicating with, they actually communicate back quite a bit, which was sort of a secondary result. That was not the intention. The intention was intervention, but they're starting to use it bilaterally, and now we're taking advantage of that. My team spends a lot of time also on the ground. So if we're in school settings trying to do work, we're on the ground observing both, again, the practitioner side as well as the family interaction. So those are a couple things we're doing.
And you saw some of the things from my presentation, but it's been rapid feedback as well as the program got off the ground. Host focus groups of parents and then separately with staff to hear what's working well and what's not working so well, and then give that feedback right away to the program has been very important. As well as having parents see how their children are doing. A program that CAP is doing that we're just starting to write about is for parents who don't speak English as their first language. And this 2-Gen English language program is linking things that you'd really like to know as a parent, like how do you do a parent, what words could you have on parent-teacher conferences, going to the doctor, understanding especially what your child is learning every day in Head Start, and then being able to talk about what your child has learned. And parents are really thriving in that, staying in the program more and wanting more advances in that type of program.
So as you probably heard from what I had to say, we think parents being involved and in leadership roles in everything that we do is really important. So we do 3 things. One, we almost never have a convening where we don't have parents as experts at every single table in that convening. And actually Frances Robinson, who's a graduate student here, was a big part of building out that program. When we write papers or briefs, we have them peer reviewed by parents to make sure that they're true to parents' lives and realities. And then the third thing that we have done is we don't offer grant funding very often, but when we do, one of the criteria that we look for in the applicants is how they've engaged parents, both in the application and design process, and also how they intend to continue engaging parents throughout the program and the review phase.
Thank you. In your work in rural communities, what particular opportunities and challenges do you see for supporting vulnerable families, particularly in rural communities?
What was the first part of the question?
Rural communities, so opportunities and challenges for engaging vulnerable families.
Yeah, I'm confess, I've been spending so much time in New York City. I don't know I don't have that much experience recently to speak to that. How about you, Lindsay?
We need Frances Robinson. She's been doing this work with professors here, I understand. We're very focused as well in urban settings. And clearly, as our mayor talked about, transportation is enormous.
And I would just say that a lot of the programs that we work with, it is a nut that I don't think we've cracked yet. When we talk to people in Berea, Kentucky, they have wonderful 2-generation programs. They figured out some of the transport, but they have no jobs. And we haven't figured out yet how we create those jobs, and that's continually the challenge. It's either the jobs or the transportation, and that's definitely, I don't have a perfect answer.
And this is the final crowdsourced question. We've seen some devastating impacts of the opioid epidemic on our local community. And what types of 2-generation initiatives do you envision that might help to support parents and children?
I was just about to say this before you said opioid, where we did an early study about 8 years ago where we interviewed mothers in 3 different high-quality early child care settings called EduCare in Denver, Chicago, and Miami about their views about all this, because we wanted to see, are we on the right track to be thinking about designing a program like this? And so there was very in-depth interviews, and the findings, I think, will make a lot of sense to you. There was a big middle group of parents who either had the motivation or some experience in schooling where you knew if you could provide the right combination of program, they would take it up and do well. And then there was a small group at the top who were going to go into programs and get jobs no matter what. They did not need a 2-gen job training program at that particular time. But conversely, there was another group that would fit the opioid epidemic who had many, many challenges, and they would not be ready for the type of program that I presented on, but would benefit very much from other types of 2-gen programs, including obviously addiction programs, but home visiting programs, and other types of programs that provide the type of intervention that they need.
Home visiting was going to be the example that I gave. We work with a couple of fellows who have a combination of home visiting through Nurse Family Partnership and then adult education and wraparound services through an adult high school and stackable credentials in Indiana. And they have had some success, and a lot of it based on motivation around their children.
This is just a thought. This does not come from any experience or expertise, but does this suggest a different role for schools for these children? And I don't know how difficult that might be in rural settings, but can schools serve as a safe place for children to be fed, to be taken care of in the context of the crisis? I don't have a lot of faith in the health system. Yeah.
So that seems like actually a tremendous starting point for opening up to discussion from the floor. There are mics between the chairs. I think if you tap on them, you can speak. So, what? Oh, okay, so those are not working. So how do we want to capture questions? Speak up, speak loud, say your name. And if anybody is having difficulty hearing the question, if I have heard it effectively, I will repeat it. Otherwise, the loud person sitting next to the questioner will have to repeat it. Okay? Yeah. So, any thoughts, questions? Yes, please.
Hi, I work with the Child Development Council, and we have family support programming with paras that have been operating in this county for 30 years. And what struck me a little bit, first of all, with the opioid question is that a lot of grandparents are now stepping into that role. So I think the asking parents and other caregivers, whoever they are, input is really important and really critical, because the perspective might be quite different from a parent to a grandparent in that particular case.
So we might be talking 3-gen or multi-gen.
Absolutely, and some of them are trying to navigate how that works in their household, with maybe the primary care going to grandparent. But so what I was thinking though was that our programs have been full, They've been full for a very long time. They're a voluntary program. And when we think about asking parents, we're totally parent-directed in terms of the services that we offer and strength-based in what we offer, but we don't get much chance to ask people who aren't in the program who might want that. So parents who aren't associated sort of naturally. That's a group of people that I would be concerned about having an opportunity to say what they need and to be part of the conversation about how we form or shape or merge or collaborate together. Did you follow?
I was just wondering, were you referring to the opioid epidemic?
I'm speaking more generally, in that there are a lot of parents that aren't necessarily engaged already, that volunteering to participate sort of cuts a group off the top, people who are willing to go to that phase, and we're full. But there's a whole nother group of folks that maybe never get their voice heard. And that's, I think, a voice that we need to hear when I think about going to scale, or I think about broadening the 2-gen approach. We should think about people who aren't naturally associated already to some programming.
So thoughts on bridging that gap, panelists?
There we go.
You need to do some research on those guys. I mean, with the research hat, you call that selection, right? So you've got people, perhaps they're already highly motivated, no judgment on whether they actually need the service, but they're motivated, they're doing it, they're showing up. And I think, just based on my past experience, one way to kind of counter that is to go out in the field, find the folks who aren't coming, and just learn some more about them as a starting point, and start chipping away at how you can redesign the always comers, the services that are offered to them to open the doors to the never comers, right? So I would say research is a good mechanism for starting there.
I would add, that's part of why we do so many focus groups, and we've done them for the past 6 years and all over the country, both with parents, with folks who are not parents, with single parents, kids under 6, who are randomly selected, trying to find out what are the issues that matter in their lives when they think about the services, the programs, or even just the navigating daily, what would make a difference. And it's fascinating because when you talk to those folks, a lot of the things that you all were talking about come up. Some of it is around safe spaces for their kids. A lot of it is around respect. And the fact that when they do feel like they need to reach out for something, they're not confident that the hand reaching back is going to reach back or is going to treat them in any way that they want to be treated. So they don't. And I also just find the type of work that Lisa does fascinating because I think there's so much we can learn in how we design, thinking about behavioral economics that would be really valuable in this area too. But I really appreciate you raising that.
Yeah, and I would add, related to our work, which I skipped over the last slide pretty quickly, but I'm sure people who are involved with Head Start are aware that even those parents who are so motivated and enrolled their kids, that absenteeism is a big issue facing these programs. So that's another place where your work would be very helpful, and why we're very excited that parents who went through the Career Advance program and did their own education and job training are more likely to get their kids to Head Start themselves. It sort of fits.
Yeah, great. Another question. Yes.
Hi everyone, I'm Nida Mahmood. I'm a first-year CBA fellow here at Cornell. I saw, particularly, Lindsay, the research that you were doing. You had people from diverse cultural backgrounds as part of the study. I was just wondering, in your findings, do you give weightage to, or was there any effect of the cultural context that these families come from?
I'm sorry, what was the last question? The set of what did you say?
The research that you're conducting, right? So the cultural contexts that these families come from, to what extent do they have an impact on the outcomes of 2-gen programs?
That's a wonderful question. And given the size of our sample right now, all we're doing is controlling for race, ethnicity in our analyses, and we hope to go further than that. As I mentioned, one thing that I didn't have time to mention is it's really hard to get into this healthcare training program. You apply, we have all these statistics in the paper, you interview, you have to pass a background test, you have to pass health test, and you have to speak English. So our particular group of parents in the Career Advance program, there are fewer Latinos than there are in the Head Start program altogether. So we're grappling with that. In the 2-gen English language learning program, we have a whole set of Latino families, and also Burmese families have moved to Tulsa. So we're going to be looking at them separately, but we've just started that study. But I think you're absolutely right, it's very key.
Can I share a cute finding? Okay. So one of the things that we think about is not only kind of the bottlenecks, but we think about how images and words might mean and be interpreted in different ways. And so we had an opportunity to do just a small little experiment where we, this particular program had 2 different ways of branding. One used an art image that featured a lot of diversity, and another one used real photography, right? That also featured a lot of diversity, but the main difference was art image versus photography, real life. And so they were hosting an event, and we kind of put both sets of brochures on top of a table, and we asked folks when they signed into the event to take a brochure. And what we learned from that little mini experiment was really interesting, which I don't have an explanation for, but most of the Spanish-speaking families opted to take the art image brochure, and most of the English-speaking families opted to take the real photograph. And you can think a little bit if when we went to focus groups and we asked folks, what do you think of when you look at this art image versus what do you think of when you look at the real image? There were very different kind of words associated with those descriptions that you can kind of link back to potentially kind of the cultures that families are coming from. That's a really tiny example, but think about the implication of that, right? If you choose only one logo and it happens to be an art image, who are you inviting in to pick that up? And who are you not inviting in? So I think there's a lot there. We also learned that for the Spanish-speaking families in New York City, there was this great idea to have tablets available in the classroom that they could check out for their children to do kind of these reading assignments. The immigrant Spanish-speaking families were not taking them out. And so what we finally learned is it's not that they were necessarily afraid of the technology, they were afraid to break the technology, right? And so really good kind of motivation, they wanted to reduce literacy demands of their materials by making a tablet available, but it wasn't being taken up by the most less English literate population because they were worried about something else. So just really small examples of how you can really learn about delivery.
Yeah, great. Other questions? Yes, please.
Janet Catracci with our local community foundation of Tompkins County. We've been working at our community foundation to foster collective impact in our community, and I'm just curious how are these programs identifying shared indicators towards sort of common goals? Are they articulating mutually reinforcing activities across these different programs? And if they are identifying shared indicators, are they are you identifying those indicators? How are those indicators being identified? How are they percolating?
A few things. So often, if the programs are truly aligned, they do identify shared indicators. So they come together and decide what those are going to be. And it can be across a public organization, a school system, as well as a community organization. And obviously that is challenging, and what's really challenging about a lot of it is also getting data systems to talk to each other. So if you have, the San Antonio, Texas, where they're trying to work across exactly those types of systems, United Way, Head Start, school system, local foundation, and trying to get that data to match up, those are where some of the biggest challenges have been. And even for instance, at the state level, when states are trying to get their data data systems to match up around shared indicators that they can agree on because they're part of one state, state set of agencies. But the early childhood folks and the workforce folks have never been in the room together. And so if they haven't been in the room together, you can be darn sure that their data systems don't talk to each other, because why would we at one state build the same data system in 6 different agencies? No, we wouldn't do that. So those are some of the real challenges that people are really working very, very hard to address. And I will say, particularly where you're coming from, there are lots of community and women's foundations who've been tremendous leaders in this space, both intellectually in terms of providing that idea and that vision for communities, as well as then doing some pilot funding. And we do actually have a case study of the Community Foundation of Sarasota County that has been a real leader in 2-generation approaches that looks at a lot of how they've done that and how they've worked at some of those common visions, indicators, et cetera. And I will also say, last thing really fast, we have, though, built out an outcomes framework for practitioners at the Aspen Institute. And when I say we, this has been a very field-driven effort with practitioners, with researchers, as well as an outcomes framework for policymakers. And then accompanying that is a crowdsourced 2-gen outcomes bank that's online, as well as a toolbox that has everything from intakes forms to case studies to theories of change.
I think we have time for one more fairly quick question. Okay. Carl, are you okay seating? Yes, yeah. Good. Yeah.
So first I would give you feedback. It was all very wonderful and very enlightening. Things that I hadn't thought about. My name is Bill Murphy. I'm a city of Ithaca resident and longest serving member of the Ithaca Youth Bureau. Although Myrick, who nominated me, didn't remember. That's okay. That's all right. And I'm retired, so I'm no longer a member of the Ithaca Youth Bureau advisory board. But my question is about the exponentiality of what you're doing. Do you see things growing, and do you find that if there's a big flood of research, do people get to pick and choose what they want? I mean, you guys must be inundated with all kinds of materials, and to pick and choose from what do you have time to follow up on, who are your favorite authors. So there's all this stuff. So about exponentiality, you see a lot of growth in your fields.
I'll give a few examples, but then I think Ascend is really the best example of this, where we're in Evanston and we've been influenced by Ascend. We developed a small program in Evanston from Ascend funding. We spoke at the high school, we do briefings in Chicago, and so we do have a variety of very interesting service agencies contacting us across the board, from the Erickson Institute that trains early childhood education teachers, and also not necessarily just in Chicago, an organization in Lowell, Massachusetts, which is looking at fathers and recidivism and 2-gen related to incarceration rates. So we are putting a lot of thought into how could we clone ourselves and how could we at least do some consulting and some advising. But the biggest issue, at least from my perspective, is funding in terms of both program funding and research funding so that you can expand. That said, I think there are a variety of smaller levers that people can use. But one last pitch I would make for women's foundations or other types of philanthropy is what I would call glue, because if you've been an early childhood organization or you're an adult or youth or adult focused education institute or agency, you're focused on your mission, and you're trying to fundraise. So what is the bridge and the glue that can bring organizations together? And there are a number of efforts like that across the country too, where it seems like a win-win. But I think the way you've developed the network is a really good answer to his question.
I mean, I would say that from our perspective, we face the same challenge of wanting to clone ourselves. We, in the past 2 years, have provided 10,000 hours of technical assistance, and that's just our small team of 10 people. who are interested in this approach. Our network, which doesn't represent even, the tip of people that are interested in this, has grown since 2014 from 58 organizations to 210. When we look at the number of states, we were at 3 and now we're at 35 that are interested in that. And that's the city level, county level, state level, and then the number of federal programs. And that has really been since 2011 in my experience, but it's not a long time horizon that this has really caught fire. And I think so much of it is because there is a lot of common sense behind it, even though we are still developing the proof points. And I would definitely second Lindsay's point about the fact that we do need more resources for research to really look at tests and programs, but on this.
Just a last note, one thing that I've been spending a lot more time on is just investing in the next generation of scholars. So both Lindsay and I are at high-level academic institutions, a lot of smart people and smart young people who through our work can get really exposed to using this, and not only using it for scientific evidence building, but also how do you work with community partners. So everyone who works with me gets a big dose of how do you do that, as well as how do you learn the science. And the second piece of that is how do you translate your work, right? So the academic model is to produce high-level technical articles for journals. How do you create other smaller pieces, whether it's blogs, which there's loads of them now, that are really tailored to the practitioner community, smaller executive summaries, sound bites, like things that can be very accessible. So I'm kind of focusing on those two things in terms of training the next generation.
Great way to end since it's the brought about our
And that is a perfect segue to continuing the discussion at the reception in the Pennsylvania room, right over there. Thank you to everyone who attended today to celebrate and support the launch of Cornell Project 2Gen. And a special thank you to our illustrious panelists. Thank you so much.